Thanks for joining us for another Contagion Coronavirus video. Today, I'm joined by Dr. Ramy Elshaboury, who is from the Massachusetts General Hospital and has been doing some impressive work at his institution, putting together some guidelines for COVID-19. Thanks so much for joining us.
Good morning. Thanks for having me.
So why don't we just get started? Can you tell me a little bit more about what your primary role in the COVID-19 response has been at your institution?
Sure. MGH is part of the NETEC Training and Education Network, so that is the National Emerging Pathogen Training and Education Network. So preparing for biothreats and special pathogens is something we are always training for, and it's something that we practice, and we have annual drills to accept patients with special pathogens and special infections. Our preparation started obviously a couple of months ago now with the outbreak of the COVID-19. And throughout January and February, we started our planning for accepting patients and understanding what each of the department roles will be, including the pharmacy department. A big part of what we plan for is obviously what therapeutics we will have available, what clinical trials we will arrange when the time comes to accept patients and admit, with some circumstances, a large number of patients. Our role started thinking about what medications we will have available, what clinical trials the hospital will participate in, and how can we facilitate the clinical trial medication receiving, the clinical usage of these medications, the clinical monitoring, and educating our staff, educating our pharmacists, clinical pharmacists on the front line to use these medications and understand the dosing and the necessary monitoring and safety of each of these medications. So a lot of what our infectious diseases pharmacy team has been doing over the last couple of months is really trying to absorb a lot of the information. Obviously, there's a lot going on, and trying to filter through all of the data we have now available and the rush of clinical trials that we will be presented with, and communicate a lot of that information to our frontline staff, our frontline pharmacists. So everyone is aware of what's coming, and everyone is aware of our role in ensuring these medications are used according to the protocol, and making sure that the necessary monitoring is in place and the safety measures are being tracked.
Great. So what are the biggest challenges that you're currently facing in your COVID-19 response?
In my role, I wear a couple of hats. As an infectious diseases pharmacist, obviously we're trying to go through a lot of data, a large volume of data in a very short amount of time. And not just that, but also react to it and adjust our guidance and our treatments as we need to. It's been fast moving, and I think there have been a lot of changes already, and we're trying to, again, absorb that information and understand what our role is going to be, whether we need to make any changes to our initial recommendations, and what is our next steps in terms of setting up of the clinical trials with the hospital teams. My other hat as a clinical manager, I think one thing we are very concerned about is drug shortages. This is something we are meeting about almost daily, just to manage our ongoing and very much expanding list of drug shortages every day, and understanding what the current treatments are necessary, and looking at the outlook of the drug supplies. Our supply chain teams have been working nonstop, understanding the extra need for sedatives and other medications for our critically ill patients. So this has been a big challenge. We've had to make some changes to our routine practices just to make sure we have enough drug supplies to sustain the rush of patients we've seen in the last few weeks.
So earlier you kind of touched upon how it's really hard to keep up with all of this emerging literature from different trials and studies and so on. So what are you doing to keep up with all of this information as it's coming out?
That's a great question. We are a team of 4 infectious diseases pharmacists, so I'm blessed to have my colleagues around me. There is really no human way possible to keep up with all of the emerging data as one person. So I think working as a team and understanding how we can split the work. And also at MGH, where our infectious diseases pharmacy team is part of an multidisciplinary team across the hospital. we have had daily calls almost since the outbreak started a month ago. And part of our daily calls is to discuss some of the challenging cases, but we also dedicate time to review the literature as a group and almost assign different people to present some of the new information on behalf of the team, so everyone is aware of the updates and everyone can stay up to date on some of the changes. And as things honestly progressed in the last several weeks, we've also started forming subgroups. So we have different subgroups tasked with specific pieces of information, whether it relates to actual management of patients on a day-to-day or planning any changes based on the data that is coming out. So we've had subgroups working on immunomodulation, another group working on specifically the critical illness needs of the patients. We obviously have a group working on how antibiotics can be positioned for patients with superimposed bacterial infections. So we've had different subgroups really going through the data and summarizing some of that information for the larger team and making recommendations whether we need to make any changes or not. So it's been a lot of data and a lot of noise in the data, and it's really taken a large group of people and a big team to try to understand and dissect some of that information so we can make clinical decisions on the front line.
Sounds like collaboration is key.
Definitely.
So my next question is, can you discuss some of your work on developing guidelines for COVID-19 at Mass General?
Of course. So as I said, we started this work 6-8 weeks ago now. Started with a small team of multidisciplinary professionals. It was assembled by our Chief of Infectious Diseases Division. This team obviously had infectious diseases faculty, ID pharmacy, but we also had representation from pulmonary critical care attendings, hepatology, cardiology, and other disciplines within our hospital. This group started early looking at the data and trying to put some guidance in place. And as I said, we started splitting into subgroups, and each subgroup was tasked with a specific question and a specific need for our clinical guidance. And as the subgroups formed their clinical guidance, then that was discussed with a large group of people. For feedback, we call our team the CHANT team. Our focus was on the here and now, so that's why we call it the COVID here and now treatment, the CHANT team. And this is a living document, something that we almost on a weekly basis continue to refine based on the data that we have available from outside the hospital, but also on some of the data we've been able to generate internally based on the number of patients we have already cared for. So it is a living document. It is updated on a regular basis, and we have this centralized group of people that is multidisciplinary, that is bringing more data both internally and from outside resources to refine that document. In terms of our pharmacy team, our focus has always been on managing drug therapy and making sure that we have the appropriate information for optimal dosing, monitoring of these safety measures, especially for medications that a lot of our pharmacists here in the hospital are not accustomed to be used on a large scale of patients like we've seen in the last few weeks. And finally, the clinical trials and understanding some of the new investigational agents that we haven't seen before, making sure that our pharmacists are aware of the safety and monitoring requirements and communicating that with all of our frontline pharmacists.
Great. So in the coming weeks, the situation is going to continue to change at a rapid pace with COVID-19. So in your opinion, what do we really need to focus on to prevent the so-called second wave of this pandemic?
I think obviously it will take a lot of efforts from a multidisciplinary and a number of different local and governmental agencies. I think testing will continue to be something that we are looking forward to expand. We've had here in the Boston area, a number of our hospital laboratories have really expanded their testing and added capacity. This is something that we will look forward to expand even further and making sure that testing is widely available in the community, not just in the hospitals. The timing as well. Some of the newer testing methodologies can produce results fairly quickly. This will be fairly significant, especially in the community when you're on the ground, or some of the ambulatory clinics, to be able to produce these results fairly quickly and identify the positive patients and start the quarantining recommendations. I think our public health colleagues are talking a lot about contact tracing and isolation, and this is something that will require a lot of efforts, a lot of technology, and a lot of personnel to track positive patients and track their contacts and work on quarantining and isolating positive patients. I think if we can get all of this in place, and if we can have these public health measures in place, I think we will be able to manage the next wave more effectively. But certainly will take a lot of efforts from a lot of different people when it comes to testing, when it comes to additional testing methodologies that are fairly quickly and can produce results a lot faster to be able to isolate these patients more effectively.
So my last question for you is, do you have any tips or resources to share with other clinicians who are currently responding to this pandemic?
In terms of tips, I think one thing we've learned quickly is everything's changing quickly, and the rush of patients is not going to slow down waiting for us to produce guidelines or to finish all the clinical trials so we have all the answers. So I think one thing we learned quickly is the here and now. What is the information that we have today, and how can we position that information to help with our clinical decisions today? I think moving forward, obviously the clinical trials and a lot of the data that are being generated today, that will help us in the future, but today we have to make some clinical decisions for a very large number of patients that a number of them is quite sick. So I think the biggest tip I can give people is to think about the here and now, and what information do we have today to help with the current situation. I think moving forward, a lot of resources are becoming more available. I think just over the weekend, the IDSA, the Infectious Diseases Society of America, published their initial guidelines on the management of patients, and it really reaffirmed the commitment and the recommendation that we need more clinical trials, looking at all of the different therapeutics that have been suggested. And moving forward, understanding these guidelines will be also a living document, and there will be changes to those guidelines in the coming months. But really the best we can do today is use what we know today based on the data, and understanding that some of the data may not be optimal, and there are a lot of limitations to understanding some of the trials and some of the case series that have been already published. But as professionals, this is the information we have, and we need to make sure that we can understand it as best as we can and dissect the information and come up with some clinical decisions that we do and follow today. But also in the future, we need to support clinical trials, and we need to position ourselves in a way that can help us produce more data in the future, more specific data that can take a lot of the different patient demographics and some of the risk factors in mind. So 6 months from now, we can have a better, more focused way of managing our patients.
That's great. So thank you so much for joining me today. I really appreciate you taking your time out of your super busy schedule to talk with us. Keep up the great work and stay safe.
You as well. Thanks a lot for having me.
Thank you.